Well, hello, welcome everyone. This is Shankar Poncelet, your host with the Shank Show, and we have today as our guest Dr. Cristin Dickerson. Dr. Dickerson is a very impressive woman because she managed to bring down the cost of medical imaging, not only here in Texas, but I believe in 49 states. So we are very excited to get to know you, Dr. Dickerson. Thank you so much for taking the time to do this with us. For our viewers, know that you can participate in this live by interacting in the comments. We are live on LinkedIn and Facebook. Some platforms don't import the comments, so don't get mad at us if we ignore you and maybe go to the other platform instead. Dr. Dickerson, how are you this morning?
I am great, thank you. We finally got some cool weather here in Texas.
Yeah, absolutely. That is very interesting that you say that because it makes me wonder: are you born and raised? Are you originally from Texas?
I am. I was actually born in Austin, so right in the capital.
Okay, so it's very interesting because, as you may know, I immigrated to this beautiful nation from Luxembourg, a small country in Europe, and people keep telling me here in Texas, "Oh, it's so warm, it's so warm." But that was actually what attracted me to this
Right.
nation and to this state. And I want to say the grass is always greener on the other side. It's probably a little bit of that going on, but also if I had to choose between always being cold and always being warm, it's certainly always being warm.
I actually agree with you, and I've been to Luxembourg, so beautiful place.
Yeah, a lot of Americans think it is a city in the UK or Germany, but well-traveled people and also people here in San Antonio, very often with the military, they have been overseas and they know. What do you remember from Luxembourg?
The airport.
The airport, yeah.
We did travel out and took a quick tour, but not much. I was actually in high school. I was traveling back from South Africa.
Oh,
And
wow.
we were pretty exhausted. That was a long flight.
Yeah, it's a country that only has one airport, and that's it. You've seen it. Um, Speaking of Texas, I know a lot of Texans are very Texas proud. Are you one of those fellow Texans as well?
I really am. My family's been here lots and lots of generations. My great grandfather took the Chisholm Trail to Wyoming and was an Indian guide there, and then came back and ran his family's ranch. And he was 6'5" back in those days. So we have some strong Texas women, some serious Texas blood in us. So yes, I am.
Mm-hmm. That's awesome. That's actually also another aspect that really attracted me to Texas is because wherever I go, people always complain and criticize their nation and their hometown, and not that there's not room for improvement always, but it's really nice when you live amongst people that really just are proud and appreciate their surroundings, and that's certainly one of the beautiful things in Texas. And I feel that also translates over to business. Like whenever I meet a fellow Texas business owner, they're like very willing to help and give each other advice and support each other.
Yeah, I think it took a lot of strong blood to survive in Texas in the early days, and so I think there is that that genetic trait among those of us born here. But we love people who love being here too. I think the diversity in Texas, especially Houston and San Antonio, are tremendously diverse cities, and that's exciting. That brings new blood and new ways of doing things. Wonderful restaurants to both cities. It's exciting to see that.
I agree. I always tell people Texas has been so welcoming to me, welcomed me with open arms, helped me grow a business, helped me to really find a home, and that is amazing. And a lot of the people outside of the United States have this like very wrong view of Texas. They see us as cowboys with running around with guns and being racist and all of that, and it's absolutely not the case.
except the running around with guns part. There's a lot of that.
Yeah, yeah, depending on where you go. Um, so I am very interested if you want to share a little bit about your childhood and your teenage years and your years as a student. What were those like, and how have they formed your life path, if you will?
Yeah, I had kind of two childhoods. I had the first half of my childhood where I lived in a small town. My grandfather was a rancher and cotton buyer, so very much I was out feeding the orphan calves with a big bottle. And my dad was county attorney and then district attorney. We were always in parades for political. So he was out politicking, and it went to a very, very small school, and definitely was racial minority in that school. And it was an incredible first 10, 12 years of my life. Then my parents divorced and we moved to Houston. It was still, I went to excellent public schools. It was still a great experience, but very different. There were two phases of my childhood. And, my mom, while working full time, she had to start over for her master's degree. She was only a few hours away when my dad, up and moved to, finished law school and moved to Rosenberg. And so she had to start over on her master's, got her master's, got all the way to her dissertation with her PhD, and did all that while working full time and raising two daughters. So
Wow.
I have a tremendously strong mother and a really interesting woman, very bright woman.
Mhm.
And I think that was formative for me. And, I hope I've been that same kind of mom to my boys. I have two sons. And college, went to Baylor University. I was going to University of Texas until the last minute. And I thought, wow, I think I need to go to a kind of a quieter place. And I'm not sure Baylor really was. It was a great place. It was, back to kind of a smaller town, which was, I loved being able to buy that Waco area is beautiful. The surrounding area, it was wonderful. I was doing a lot of bicycling then. It was a great experience. Got into medical school, came back to Houston for that. So again, two phases. And finished my training in Houston. I actually did interview nationally for radiology residency, and everybody said, "Why are you leaving Houston? MD Anderson has the best faculty in the country." And that was very, very interesting, because I really thought I would go to a different residency program. But that part of it, not having to uproot and still being able to get world-class training, was really nice. Being able to stay with my family. I live with my family, but having my family around during hard years was really great.
No, I can relate to that, because I was raised by a single mother too, and let's just say you get a lot of appreciation for single women who are parents and who just make all these sacrifices to do what's best for their children. And I mean, I was a single child, but so were you was your mother during a certain phase also a single parent then?
Oh yeah, definitely.
Yeah.
She did not marry my stepfather until I went off to college. So
Okay.
yes, that whole
Yeah.
second phase of my childhood, she was a single mom.
And I would say, again, I see you as a very impressive, well-established, well-rounded businesswoman, and I think that's most certainly something where the foundation stem from that, from seeing your mother manage all of that. That is great.
I feel quite blessed.
So we have a question here. Andrea Ferguson, she wants to know if you know Pearl Beverly from Baylor University.
I don't, Andrea. I am probably younger than I am.
Okay. Well, I had two phases of my early adulthood too. Well, childhood, I was just like you. I grew up in a very small village, and when I say small, it's like less than 50 inhabitants in the village,
Wow,
and
that's small.
then later on I joined. I read these books about a young girl who was at a boarding school that was set in an old castle, and I kind of romanticized about that. And luckily, I found a boarding school that was set in an old monastery. So as soon as I could, was probably around 16 years old, I volunteered to go to boarding school because everyone else there was sent there kind of as a punishment. But for me, it was my escape, get out of the small town into a bigger city, for Luxembourg standards, and spent there my high school years with 80 other boys, and that was like having 80 brothers, and it was a lot of fun. um so when so there was never really a phase in your life where it looked like you would take a different direction than medicine, right?
I contemplated, my father and my sister are attorneys, and we have lots of attorneys in our family. I did contemplate that. I think the what I love about, especially about radiology, but about medicine in general, is it's kind of a puzzle. It is a trying to put together signs, symptoms, even a person's personality and risk factors, and come up with what's going on in their healthcare. And that's really what a radiologist does. A radiologist is really kind of a doctor's doctor. We take, the images, what's happening inside the patient, what we're given as far as clinical information. We piece that together, and we have to decide, okay, if there's a lesion over here and a lesion over here, are those related? Are they two different things? And so that kind of problem solving was very attractive to me from an intellectual standpoint.
Yeah, I can see that, and I have noticed that very often it feels like, especially in emergent situation, it feels like, okay, so the patient comes in, and then the first thing the physician needs is imaging, and I find that very interesting. And it also, from a layman's perspective, like the physician makes it sound also like, okay, so they get these images and then they still cannot really interpret them. So is it so that you kind of need really deep special knowledge to interpret those, or are they just not allowed to make deductions from those images?
We spend, my training was, I did a clinical internship, what's called a transitional year, where I went into OB-GYN practices, internal medicine, surgery, pathology, got the gamut, because we do have to be able to answer questions for people in all specialties. And so did a year of that, and then 4 years of additional training in imaging. And so it's a long learning curve. And, there are specialists who kind of read their own studies, like to look at the images, and that's great because, I'm smarter if I have a doctor looking at the images with me. They can say she hurts right there. And that's, and I know that's going to be humeral head. I know what those anatomic parts are. And so it makes me smarter. Yes, and they know exactly where to look on the image. Now, it may be that the neurosurgeon who's looking at the brain misses lymph nodes in the neck, misses other things, but they can be very good at their specialty and looking at the images because they do that, day in and day out. But, really what we're doing is not just looking at the brain, we're looking at everything around it. And so that's what we're trained to do.
So you sometimes also see problems that the specialist might not even pay attention to, or it escapes him, and you are there to point that out.
That's really true. And we really, I've learned what population management is since I've been in this kind of the healthcare plan world that you and I are kind of living in. And I would say I now read even differently than I did in in a multi-specialty group setting. I read on a population management kind of basis. I'm looking at atherosclerotic disease. I'm looking at vertebral height, seeing if they need a DEXA scan. Really reading, I'm reading more holistically than I ever did. And I always did that to some degree because I was working with internal medicine doctors primarily. But that has really become a big part of my practice. And I think it's a really useful one. I think we're looking at predictive, what can we see that's going to cause this patient problems down the line. If the aorta is really tortuous, they may have hypertension, and I'm going to point that out. Especially right now when people have gone through these gap years of healthcare, this pandemic, people really, during the shutdowns, we were at about 50% capacity. That went up 60, 70% in imaging. Still, I think yesterday we were getting we're still not at our pre-pandemic reading levels, but yesterday we were getting pretty close. So I think people are starting to get back out there and get healthcare. But, we know this has had a tremendous impact on longevity. It's not just COVID. It's also that we're diagnosing cancers at later stages. And that's going to have a significant, in our world, that's going to have an impact on the workforce and the expense of healthcare and employer-funded healthcare plans. But also, it's going to have an impact on families. It's a significant problem. And, I think we need real public service efforts to get people back out and getting healthcare. There's also the thought that, people have been getting telehealth. Well, okay, a telehealth doctor has some kind of disincentives to order imaging. They're really handling the acute event. Now, if they order an image, that x-ray comes back in, may or may not be on their shift. Who's going to correlate that with the clinical findings, get back to the patient? And so we've noticed that telehealth providers order imaging at much lower rates. And I think that may have, not that there's not some overutilization by primary care doctors of imaging, but what people call overutilization to some degree is also reassurance. My husband yesterday, who's had kidney stones, was having abdominal pain and went and got a CT scan to make sure he didn't have kidney stones. He didn't have hematuria. He didn't have secondary signs. Somebody may have said, oh, he doesn't qualify for that CT scan. But we knew he didn't have appendicitis or, a stone. That was tremendously reassuring. So I see all the time where negative studies are quoted as a bad thing. Negative studies are not a bad thing. Negative studies can be tremendously reassuring.
Oh yeah, I can see that. And so I think it is safe to say that one could say that imaging is a staple of practicing medicine. Really, it is usually one of the things at the beginning of a relationship between a patient and the physician that needs to happen. And I think you realize that, and very quickly also became interested in the cost components of that service. I heard you speak at other occasions where you were able to really break that down. And if you want, I want you to do that again, because you're really a master at understanding what are the cost components, and you saw an opportunity to basically reduce waste, essentially.
Yeah, I started green imaging 11, almost 12 years ago now, because I saw a need in my community, which was affordable imaging. Houston had an accelerated problem. We had 21% uninsured. All of the cash pay imaging in the city was targeted to the Texas Medical Center international visitors, who were typically wealthy. And so we were still going to be able to, in the outpatient imaging world, save them some money from the hospitals. But, there were no affordable options. And then as far as if you had a PPO, which most people did at that point in time with a high deductible, the imaging centers the outpatient imaging centers were operating out of network. They didn't like the slashes that they were getting from the insurance companies. So they were charging large fees. And then the imaging center that was in network, that chain was bought by a hospital system, and overnight the prices went up dramatically. So there were lots of factors coming together, and I would have friends call from, being sent down the hall by the orthopedist at the hospital to get an MRI and saying, this could be $3,000. Can you do better? And actually in the multi-specialty groups that I worked for, we were outpatient. We were accepting, doctors who have in-office imaging. It's typically affordable imaging. And we did have some options there, but in the big city, overall, there just weren't options. And so my first thought was, okay, I'm going to open an imaging center. I can do this cheaper, better. And I really couldn't, the price of real estate, the cost of the machines, the cost of the technicians, I really couldn't do that. But I had founded a radiology group, and we were reading at these imaging centers across town, all over the city. And they had extra time on the tables. That was my other reluctance in opening another imaging center, was there were all these imaging centers out there that were at 50% capacity. So kind of models like Travelocity were emerging, where people were taking excess capacity and selling it at a discount. Mm-hmm. And so I kind of investigated the legality. I had to look at, and entrepreneurs have to do this. You have to look at what the regulations are and figure out how to get around them. And so actually the Stark laws, which are what regulate physicians being able to refer patients somewhere, those Stark laws allow radiologists to do lease arrangements with imaging centers in a way other doctors can't, because we're not referring physicians. And so it's not my patient that I'm sending to my own imaging center, mm-hmm. Which is what they're trying to, because the fear is that there will be overutilization if a doctor has that kind of incentive to send patients for imaging. And so I was able to do lease arrangements with imaging centers where I was reading, and at discounted prices, because this was just time on the table that wasn't being used. And that's where green imaging came from. We are green. And offer imaging at a more affordable cost. And, typically in the outpatient imaging world, an imaging center would contract with a radiologist, pay the radiologist a flat fee to interpret the scan, and then bill globally with one bill. That's been going away. There's more and more split billing where the radiology group bills separately. But that's been a model. And so we just turned that on its head, where we bought the scan from the imaging center, we read the study, and then we bill globally. And that keeps us in control of that lower price. And so it has been a good model. We've been able to hold down costs. Typically, I always thought hospital transparency would be something that would really, bring down the cost of imaging across the country. Instead, the mergers and acquisitions in the private equity space have driven up the cost of imaging. They're putting together chains of imaging centers. They're reviewing the contracts of all those imaging centers and billing out under the best old contract, which is typically twice what outpatient imaging used to cost. The radiology groups are aggregating in private equity-backed radiology super groups. They're doing the same thing. They're aggregating contracts, billing out under the best old contract. And so what we're really seeing, and then there's inflation. And so what we're really seeing is the cost of imaging going up dramatically in outpatient imaging centers and in hospitals nationally. And so, to some degree, our prices are even better because we have these established contracts with imaging centers that, are fixed rates, and so, while this is going up, the gap is widening. And so we, not always can we save patients money. In fact, I think for some doctors whose patients are tightly geographically aggregated, they may do better, just contracting directly with an imaging center. What they're not going to get is, and you live in the direct primary care world, this world where doctors are trying to take back healthcare and control what happens and control quality. We have a radiology group at our core of green imaging, and we make sure a lot of things happen properly so that a patient is actually getting the best study. I'll tell you an example is that CT scans of the chest are ordered without and with contrast about 30% of the time. That almost never needs to happen. It's added radiation, it's added contrast, and it's added cost. And so we look if it's a pulmonary nodule that's being evaluated, or if the lungs are being evaluated, that doesn't need contrast. So we downcode, what's called downcode that exam. Radiologists can downcode. We can take away radiation. We can take away contrast. And so we downcode that, save money, it's going to, save radiation, it's going to save contrast. Or if it's something in the central chest, we actually do it with contrast only. And so there are ways that we can help a doctor, even a DPC doctor, provide better care. And the incentives of the imaging center are to do it without and with, because they're going to make more money.
Right.
So, again, it's trying to align incentives in healthcare, and we can really help with that. The other thing we can do is those imaging centers are typically going to just offer the basic imaging in the outpatient world. When we have arrangements with hospitals, we go and shop hospitals. We'll get a bundled price at a hospital, which requires getting the hospital's fees, the radiologist's fees, and if it's like an MRI, sedation MRI for a kid, that's the anesthesia fees, contrast, all of those things we bundle and get one price.
Yeah, I'm going to blend in here your website briefly so people know that they can go there and get all the information. So when this is obviously something that is interesting for physicians, for physician groups, is it also something that just an individual can decide to go through you?
It is, that's at our core. We were a self-pay imaging network and really 90% of Americans don't reach their deductible. So they are self-pay. If you don't think you're going to meet your deductible, you are a self-pay
Good way of seeing
individual. And so we need to reframe that. We've got to start thinking along those lines. And so, yes, we do have those self-pay options. We have, I think, the nicest facility in Houston. Some guys from Baylor College of Medicine who were running the advanced MRI there have opened their own imaging center here. I mean, you've got a TV on the wall when you're having your MRI. It's a beautiful facility, great technology, great patient care. And we've got, I think, the best price in town for an MRI there. Now, you may be able to, an open MRI center or a lesser quality center somewhere get a better price, but really for what we're offering with board certified fellowship trained radiologists reading it, I don't think you're going to get a better deal anywhere. And our patients who go there just have a wonderful experience.
So me as a patient, if my physician tells me we need an MRI, what I should do as a patient, say, no problem, I know a place and I'll go there and get that MRI for you. Is that how it would work?
It is. And, I taught all my friends very early in this journey that the doctor's going to say two things. Number one, well, it's got to be a 1.5 or 3T MRI. And you say, it will be. Okay. And then they're going to say it needs to be a neuroradiologist or an MSK radiologist. And you shake your head and say it will be. And you get that prescription and send it our way.
Mm-hmm. Yeah, I think that's part of the problem too about patients being not certain in making the right decision, and then they go with whatever the physician recommends. And yeah, I think that's part of the overall problem, is just getting more agency back to patients by also giving them confidence in making these decisions, which requires a lot of education, which I know is something you do.
Well, and that's part of this. That's why consumerism has failed. The average consumer, and this is one of the things that's happening with hospital, quote unquote, transparency, or hospital opaqueness, as I would call it, is that they are, to give a good faith estimate to a patient, they're requiring a CPT code. Most patients don't even know what a CPT code is. And, even a doctor has to go look that up. And so, the barriers that they're putting in the way of consumerism are very interesting, but it's not something that a patient should have to know. I mean, really, whether or not that exam, the CPT code, is specific of whether the exam requires contrast or not. The patient shouldn't be establishing that. Even the referring physicians typically will leave the order vague so that the radiologist can specify that, and the patient can get the best exam.
Mm-hmm.
So it really is a travesty. And so I think that's why Amazon's failed. I think that's why a lot of these big companies are failing in healthcare. Number one, they're relying on secondary providers and, to hold down cost. And that's not the best way to practice medicine. I mean, the differential between the training of even a nurse practitioner who's going to be a high level secondary provider and, an internal medicine doctor is huge. There's a huge gap in training. And so I think that, the effectiveness of a physician who's self-assured and knows, what they're doing, compared to a secondary provider who these are frequently not even overseen anymore by a physician. And so I think that's a problem. And then the other problem is that, people need guidance. People need that. Not only do they need guidance from a physician, they want guidance. When people are under healthcare stress, when they're scared, when they're hurting, they want help. They want a doctor. And we have to, our concierge staff are really trained on that. They've got to show compassion. They've got to understand that patients are going to be grumpy when they're scared and not feeling well. And we really have to hold their hands and get them through the process.
Yeah. Yeah, I noticed that with myself. I mean, I'm probably more educated than the average American, but when you stand in the reception and the medical assistant asks you for your insurance, even though you have prearranged a rate and like you have to fight for your right to do it your way, it's just it's not easy. It's not easy. I want to, so if I understand you correctly, and I find this brilliant, your entrepreneurial way of solving this problem, you essentially build something up that has a lot of physical assets, all of these buildings, all of these machines, but you created with green imaging, at least in its initial stages, if I understand you correctly, it's to a large extent a theoretical concept, right? Where you put an umbrella over excessive capacity that existing facilities had, and these were all business driven, and they said, well, yeah, we have capacity, we're not selling it, so we're happy to give you a volume discount in a way, right?
Absolutely. It's really a virtual, we call it a virtual network.
Yeah.
We don't own brick and mortar. Actually, we closed our imaging center, the last imaging center we owned, and the last one I think I'm going to own during the pandemic. We had been offering a $250 MRI with inflation, with with all the extra efforts, with all the cancellations during the pandemic. We were just going to have to go up to similar pricing we would be competing against the imaging centers we work with. And we just didn't want to do that. And so, yeah, it's a virtual network. It's not brick and mortar.
So as an entrepreneur, I'm interested in how since you deal with these individual entities that have their own internal rules and their own ways of hiring and recruiting and all of that, how do you guarantee a certain standard of high quality? Because I know you have excellent ratings. How do you make that happen?
It's quality is a very difficult thing to measure in imaging. In fact, Medicare's tried to put numbers around it, and they're all silly. Covera has tried to do it to some degree, and they've done it for MSK. But the things that they, I asked specifically, what are you looking at? Age of the equipment, age of the radiologist. Well, what's good for a radiologist? You want them to be older, younger, in between, all kinds of things that to me, in my world, that's not what I'm looking at. The way that we assure quality across the network is, number one, we read most of the exams. Our radiology group, and I handpick these radiologists. A radiologist is not going to put their name on a report on a bad study, or if they do, they're going to say the patient was moving, and so the exam is degraded by this, or the patient is morbidly obese, and the exam is degraded by by that. But radiologists are going to put their name, and surgeons are the same way. Texas Medical Management, which used to be Texas Free Market Surgery, their philosophy is they're going to pick great surgeons. Great surgeons are going to operate at great facilities. I mean, that's just a given. And so that's the first way we assure this. Number two, where we don't read the study, we as radiologists have peer review access to images and reports. And so I've only had 3 complaints since we've been doing this of image quality. And so the first one I went in and looked at, the patient had moved. It was during the pandemic. The patient had moved during one of the sequences on the MRI. The others were stone cold normal. I passed it to my neuroradiologist who agreed with me. We said, you know what, this is a perfectly normal study. If you were a family member, we would say, don't go repeat the sequence, but we'll offer it at no charge to you to go repeat that sequence. I had another one that was it was a mammogram. And the doctor said, this is a crummy mammogram. Well, that really doesn't happen. Mammography is the most regulated of all imaging modalities. And the machines set the density rate, it's very automated. And so we looked at it, the patient just had very, very dense breasts. So we got her over to MRI and got that exam done. So, and then the third one actually was we had a new scheduler who scheduled the patient on an open MRI, and it shouldn't have been. And we just repeated that exam on a high field magnet. So, those are the kind of things that happen. But if we had we had an orthopedist complain, these aren't good, this isn't a good facility, it's not positioned properly, we would go look at it. And if he were, we've had those where he just wants to do it at his own facility. But we've had that kind of complaint. We either work with the facility and make sure that they're doing this properly, or we go on. We have a very redundant network, and that's intentional. And that proved to be wonderful during the pandemic when things were shutting down, or, one facility, their ultrasound tech was out quarantining, and so we could move it to another facility. The other time that really, and this is the other place that individual imaging centers can't really compete with us about, is that on Friday afternoon, when somebody needs a stat DVT study to stay out of the emergency room, and our Friday afternoons at Brain Imaging are wild, because we're juggling 6 or 7 of those patients who we're trying to keep out of the ER. And we can call around and find, and that's why we have some facilities that are actually higher priced in our network as well. We want to have that redundancy so that we can get that patient in somewhere and get that exam performed and keep the patient out of the ER.
Yeah, which makes a lot of sense. So I have a few questions for you as a business owner, because a lot of my audience is interested in that. What is I just know that you have a lot of different things on your plate. You're a mother, you're a business owner, you have all of these things to handle. What is your number one tip for managing a lot of workload?
Resilience. You have to, I think, we have kind of a crisis with one of our vendors right now, and it's an important vendor. And so we're having to migrate to another vendor, and we've done this before, and I know it's going to be okay. I've got our attorneys involved, I have the right people, and just taking a deep breath and getting through these crises, knowing you're going to emerge on the other side. We've had more crises. We've had my first partner in Green Imaging, 42-year-old man, did not wake up one Saturday morning. He had hypertrophic cardiomyopathy, it turns out, and 3 small boys, and just didn't wake up one morning. That was a crisis. We've gone through the pandemic. We've gone through being sued by a competitor. We've gone through now twice where we had major vendors, they circled the drain, and we had to make quick moves. Those things happen, and I think really it's being resilient and being confident that you can ride this out. I remember the first days of the pandemic thinking, okay, I've got 20 employees. We're at 50% capacity. What are we going to do? And my husband and I just made the decision that we were going to put them to work. We were going to be a better and stronger organization. We were going to build up internally, and we were going to get through it. And as it turned out, that proved to be, a great decision. I couldn't have I don't know who I would have laid off. That just didn't make sense.
Mm.
And so I think we emerged stronger on the other side of that.
Do you have mentors in business?
Do I have mentors in business? I have mentors in radiology. Do I have mentors? Yes, I do. I was actually in a Vistage group, and I have a couple of friends that have run 3 or 4 friends that just run beautiful businesses.
Mm-hmm.
I'm so admiring of a business that just
Yeah,
clicks,
me too.
and so, one of them is a plumbing and foundation company here in Houston. And I'm always interested to be a client and just see how beautifully they manage, the initial experience all the way to the end. And I actually had something go wrong with a plumbing job, and just how they handled that gracefully. That I love to see businesses. And so those are going to be people that if I have a problem, I'm going to go to them and say, how would you manage this? And so I don't know that they're mentors. But they're also peers to some degree. Because in a Vistage group, you're all helping each other. And
so that's a professional networking group, or just
it is. Vistage, you have around 20 CEOs that work together, serving as each other's board. Mm-hmm. And it's also an education. There's an educational component. Mm-hmm. It's a very good program.
Mm-hmm. Yeah, I have something similar that I use here in San Antonio. It's called EO, right. Entrepreneurial Organization. Yeah, I highly recommend being part of something like that. So as a marketer, I'm interested in how do you get the word out? What do you do to because you're in 49 states now,
about
right?
To be 50. We've got New York launching probably beginning of next year. It's been interesting because we very early connected with Health Rosetta, Free Market Medical Association. In part, they educated us on what was broken in healthcare. But in part, I've spoken at their events. Now it's kind of an ecosystem. There's several groups of brokers, Mitigate Partners, Carl Schuessler's organization, and then Nelson Griswold's Next Gen Benefits. Those are also communities of benefits advisors who are trying to do the right thing for employers. They're out of that broken system where, the higher the cost of insurance goes, the more money they make as a broker, which is just, obscene. So they're trying to change that. And so we have typically, and then David Conterno's organization as well, we have typically, sponsored their events and spoken at their events and participated in those communities. And that has really, without a formal marketing plan, that has resulted in as much growth as we can absorb. So I think the educational process of, I'm actually writing a book right now. I think the educational process of helping people understand how broken the existing healthcare system is and getting them across to the other side. I spend a lot of time just talking to people. And you know what? They have a friend who then has a business, and that employer comes my way and wants to be a client. So I think it's really been that kind of natural growth and really the educational process that has kept us growing without really having to do traditional marketing.
Sounds like there's a lot of what we call organic exposure that is just grounded in you being, first of all, passionate about what you do. You have the willingness to help, and you educate. You show up, you speak, you take part in leadership, as far as I can tell, in the Free Market Medical Association, and you're not shy to go on a live with me, and that's really, and I say that because that's really, I get so many healthcare companies or wellness related companies who ask us for guidance, and I personally don't believe in paying your way, but paving it by doing the things mentioned, and I'm happy to hear that works for you.
Yeah, this is energizing for me. I love discussing business, and I love discussing, what's happening in healthcare. So you're a great conversation.
Yeah, I agree. That's the perfect combination. So a word about, if I may ask about your perspective as a woman in business and also in an industry where, correct me if I'm wrong, but it's very male dominated, or at least to a certain extent it was until a certain moment in time. But what advice do you have for other women who want to be entrepreneurial in healthcare?
Um, it is. We looked around at Health Rosetta, and we actually Health Rosetta, they had a live karaoke, a live band karaoke, and we were up there with the lights and the music, and the women of healthcare, as we called ourselves. And it was a small group. There were about 10 of us up on stage, and we did Gloria Gaynor's "I Will Survive" as our karaoke. I think they're tremendous opportunities. I think women have compassion. I think women understand what good healthcare means in a family. I think women understand the astronomical costs of healthcare are holding back the average American. They're depressing wages. And 50% of people are going without care or delaying healthcare because they can't afford it. And so I think women can be part of the solution. I think anybody who's just looking for a career change, I think really becoming one of these reform-minded benefits advisors. If you're somebody who can educate and excel by the process of education, I think looking at some of these benefits advisors organizations and what they're doing is a tremendous opportunity. Employers need it, employees need it. There are just so many ways that women can help fix healthcare. Direct primary care is such a wonderful business model for physicians. I've even, because I have that clinical year, I can go hang up a shingle and practice medicine. And I've often thought I might end my career as a DPC doctor. That might be a wonderful way to wind down my career. So I think that model is lovely. I think it provides tremendous health care. Women are really great Sherpas, and I think of the DPC as really a Sherpa through the healthcare experience. And then specialists, even Diana Granita has this direct specialty network, and she's really trying to educate even specialists that they have options. Surgeons, it's pretty easy. They can get into the kind of bundled care. Tara Isaacson here in Houston is doing quite a bit of that. She's going to be working with us on a pilot. We're going to do a colon cancer screening plan where we look at risk factors, help individuals decide, should they do FIT testing annually, should they do Cologuard every 3 years, or should they just have a colonoscopy depending on their risks and the benefits. And we also have the CT scans, the CT colonography. So we're really trying, right now there's a 4-month backup in some places for a colonoscopy. So we're really trying to give people multiple options. And then for employers, this really holds down costs to use Cologuard. And actually the best screening exam there is just doing a FIT test every year. And that's what I'm going to do. It's much more affordable, and you catch, if there is a cancer, you catch it earlier. So, that's my preferred model. But we're really working with Tara. She does do colonoscopies here for bundled pricing, and she's going to be our go-to person. And she does it at multiple sites, and she's giving us bundled rates. So we're really looking at offering that. That's a specialist colorectal surgeon, who's going out and creating a new market. I think endocrinologists can actually, because they have chronic care patients, rheumatologists, the same patients are coming back year in, year out. Some kind of subscription-based model makes sense for them. So there are just so many ways you can do this and cut this. I'm fascinated by what people are doing. There's a group of cardiologists who's done kind of a green imaging of cardiology. They've done a national network of cardiologists. So it's fascinating to see what's happening in healthcare, and I think there are tremendous opportunities for women out there.
Mm-hmm. Well, I think that's a beautiful note to end this segment. I thank you so very much. Also, that you were willing to kind of approach it a little bit from the personal angle too, to make it more accessible to everyone. And I just urge my network, please connect with Dr. Dickerson, follow her, connect with her. and learn what you can do to help you reduce your cost and give better healthcare and imaging to your employees and your network. Thank you so much, Dr. Dickerson. Any final words before we wrap this up?
Well, just thanks for having me on today. It was really interesting to hear a little more about you, and so appreciate all you do from a leadership standpoint and getting the word out about healthcare and empowering people to take on business, because it is empowering. And I think for women that's an important thing, especially for women who don't feel empowered in their workplace. Create your own workplace.
Love it. Well, I can certainly guide in that if anyone is at the very beginning and feels like, where do I start? Please reach out to me. Dr. Dickerson, I wish you a great rest of your day, and I know we'll be in touch in the FMA and in other things we do together. Thank you so much.
Take care. Enjoyed it. Thanks so much.
Bye.
Bye-bye.